Hello, viewers. What we do when some near and dear one of ours get a breast cancer? We'll be panic and we'll be going to a hospital and they'll be doing a biopsy. And post biopsy, if the breast lump is just located in a single place, we'll be just removing it through a mastectomy. Or if it is spread to a multiple place, we'll be saying that partially we can remove and then go for radiation and the chemotherapies. And the story continues. It come again. We again put certain drugs. We again try to control it, and eventually we lose our loved one. So I'm discussing today about one such case which we got back in May 2024. So she came to us much later in January 2025. On 24th of January, she came to us. She got diagnosed as a breast cancer patient in May 2024. But unlike everyone, the moment they got diagnosed, they thought that, okay, life is going to be ending. So it is not a hormone negative tumor, it's a hormone positive tumor. Luckily, she had a HER2 positive, one of the tumor hormone marker which we find in breast cancers. So the moment she got diagnosed, she got scared, and the whole family decided that she don't want to get into conventional therapy because of the fear which is there around the conventional therapy. So she told like, I won't take any medications. Let me live like this and I'll die like this happily. The whole family went to multiple places, tried many herbal therapies, many traditional therapies they have tried, but it was not subsiding. So when she came to somebody told about us, they came to us. When she came to us, her breast is quite enlarged, nipple was retracted, and she was literally scared what will happen over here. And only thing they have seen is like, okay, we are doing something different called oncothermia compared to the other hospitals. So they want to explore the oncothermia. So when they came, I explained them like what we do, how we do. So we are not going to extremely remove her breast or trying to put only chemotherapy for her and get things out of her. We told that this came because there is a deep-seated metabolic disturbance inside your body. Let us try and identify what are those metabolic disturbances. So like every patient I've told in the last video also, when we check, in this particular patient, when we checked about their blood, what we found finally first was the vitamin D is 14.5. There is only very, very minimal amount of vitamin D inside the body. And again, if you look into her vitamin B12, it is just 249. Her insulin levels were more than 50. Her iron levels were very, very low, unlike in the normal cases what we see. And similarly, her estrogen levels were very high, and she adding a CRP levels of more than 5. So this is a scenario which we have seen in the patient, and the breast and the lesion was very much predominant in the breast as well as some axillary lymph nodes. And the PET scan which I repeated after 6 months after a diagnosis, it has even gone to her liver. So this patient, so we told her how to make the terrain. Terrain means a soil. We need to make the soil infertile for the cancer to grow. That is a primary approach what we do over here. So we started with our oncothermia sessions and the dietary changes what we do over here. And along that, we have provided her supplementation. And after 6 months, when her vitamin D levels become 63.8, her homocysteine levels become 10, her iron levels become 59.2, her B12 level becomes 1712. She is cancer free at this particular point of time. Today, today I had a consultation with her in the morning today. Her entire metabolic parameters are doing very well. Her vitamin D levels today at this point of time is 109.2. We checked it properly, supplemented it properly. Today, we have even removed all the supplements from this person's body. So from a breast cancer diagnosis where she was thinking that I want to die peacefully without taking any torturous treatment, coming back after 6 months of diagnosis, putting the right kind of metabolic therapies by correcting all the micronutrients, removing the fear of disease from the patient's mind, and putting her on right kind of chemotherapy on a lower dose, along with oncothermia and other corrective therapies, we have brought that patient back to their life. The credit does not go to us, the credit goes to the entire family, because they stick together through the entire process. They were supporting each other. They were taking care of her diet very well. There were occasions, all these stories, I'm saying the positive. There were occasions she got fever, she was not moving well, she was, her mentally, she was down because the diet change, what we do, we have to deviate from whatever we eat every day. We need to correct so many things. We have to let go so many things which we like. But when we stick together mentally, positively, that we are going to make a change with the modern medical approach, with the drugs, with the metabolic corrections, today we can see that the patient is back to their life without any cancer. From a 14.5 of vitamin D to 109, the story itself is showing that where the things are going wrong. It is not always the genes. we are somewhere targeting a different target and killing our people by ourselves. So combining everything together, this is a case of breast cancer with liver metastasis came back to life, even though they started a treatment after 6 months of diagnosis. So imagine if you are a case who got freshly diagnosed. Don't be panic. Don't think that you have to remove your breast. We remove the breast or we remove any organs from the body only if it is obstructing with your day-to-day function. Otherwise, every cells which has a cancer can be reversed. But again, always be mindful, only 70% we also get results, 20 to 30% sometimes we also lose the patient. So expectation is there, but still we need to work together as a group for getting the things out. So breast cancer, even on a metastatic stage, it is reversible. Thank you very much.